We're going to move now to the gentlelady from Connecticut, Mrs. Hayes.
Thank you. Good afternoon. Firearms are the leading cause of death for children and teenagers in the United States. Pediatricians, trauma surgeons, emergency physicians, and public health experts have repeatedly described firearm injury as a public health emergency. As my colleague stated, when you were asked during your confirmation hearing if you believe firearm violence was a public health crisis, you answered with one word: no. You went on to say, you believe that HHS can explore solutions for the behavioral health and substance abuse epidemic without compromising sacred rights and freedom. According to EdWeek, which measures school shootings at K-12 schools resulting in injury or death, there have been 26 school shootings since you were sworn in. According to the Gun Violence Archive, which measures any gun discharge on school grounds, there have been 240 incidents since you were sworn in. In 2026, we have seen school shootings in Rockland, Maryland, Detroit, Michigan, Crandall, Texas, Bulverde, Texas, Ferguson, Missouri, Oklahoma, Bethesda, Maryland. As you stated, I understand that you don't have full jurisdiction over the law enforcement side, the DOJ, the FBI. And since this committee has refused to respond to my request for a hearing on school shootings, I want to ask you about the things you do have direct jurisdiction over. HHS holds jurisdiction over public health aspects focusing on mental health services, trauma support for survivors, data collection to prevent gun violence. Since under your tenure, we've seen threats of cuts to SAMHSA, cuts to school-based mental health programs, cuts to the CDC staffers who work on research and prevention, cuts to bipartisan community violence prevention programs. They've been terminated. So, Mr. Secretary, since you were sworn in and now have full visibility of the harm of gun violence to children, has your position changed? Do you believe gun violence is a public health crisis?
I believe it's a public health crisis, but it's not. We don't have jurisdiction to
the things you do have jurisdiction over.
And we're doing those. So we're doing more studies on the etiology and cause of gun violence, the first that have ever been done in years.
Sir, I have to stop you.
And
I only have 5 minutes, and I apologize.
You asked the question, so I answered it.
Well, I want to know specifically why the research and the funding has been cut for these programs that address trauma, that address student survivors, that address school-based mental health programs for students who are affected by gun violence. You're putting out all of these programs, all of these studies about keeping kids healthy. Keeping kids alive is part of keeping them healthy.
And we're trying to do that by doing the studies to understand why people commit mass shootings.
But you've also cut funding.
And that has not been done before.
You've also cut funding.
By the Trump administration.
Sir, I'm going to have to ask you to exercise some restraint. You're a Kennedy. You know how oversight hearings work.
Well,
and we don't want the second graders to think that your interruptions are rude, disrespectful, or impatient. So I'm going to have to ask you to just allow me to finish my questions.
Well, don't pretend you're
in my home state of Connecticut, where I was a school teacher, in the classroom on the day 20 children were slaughtered and 6 educators, we worked really hard to see firsthand how to invest in our communities and provide prevention. Connecticut has created some of the strongest school-based violence prevention systems in the country through multidisciplinary threat assessment teams, early intervention programs, and partnerships that help schools identify concerning behavior. I put forth a bill, the School Violence Prevention Act, to begin to collect data to see how we can have federal programs to address these traumatic outcomes for kids. Many of the things that we fought for in the Bipartisan Safer Communities Act have been cut. So I have to ask you, what have you done to address the health of children? You point out so many other things about the food they eat, all these other things. What have you done to keep kids safe from gun violence outside of commissioning a study?
As I said, we have no law enforcement. Congress has not given us law enforcement.
I'm not asking you about law enforcement, sir.
What we do is we study issues and we study problems, and we're doing that with gun violence, which has not been done before.
Specifically, a study that you've commissioned.
We did it, we've done, I think it's almost near completion. We did a study on school shootings to look at what the shooters have in common, what medications they may have been receiving, whether they were on SSRIs, whether they were on benzos, and we're expanding that now across the agency to do even more of those.
The gentlelady's time has expired.
I'd like more information on that study because I'm unaware of it. I yield back.
Happy to
The
provide it
gentlelady
with-
yields back.